Hi, everybody. Thanks for tuning in for our Mission Monday on this beautiful day. We have Karen Duke-Smith with the Children's Trust of South Carolina. She's a Senior Program Coordinator for the Strengthening Families Program. And we have our Executive Director, Emily Parrish, from the Children's Attention Home. And today we're going to be talking about adverse childhood experiences. And so this is something that impacts so many different areas of service, but particularly with it being Foster Care Awareness Month, we wanted to focus on a topic that really demonstrated and helped people at large understand some of the factors that that impact children in the foster care system and how you can support them, how you can help them. Even maybe you're not a foster parent, maybe you're not working directly in foster care, but there are ways that you can help protect families and help support kids that have experienced some of these traumatic experiences. And so the Children's Attention Home, for those of you who don't know, we are a group home for children who are in foster care, and we serve foster children and homeless youth. And so all of the kids that we serve deal with the fallout of some of these adverse childhood experiences. And so with that, we're going to get right to it. And so I'm going to turn it over to you guys, and I'm going to ask you some questions. So for both of you, whoever wants to go first, can you describe briefly to those who are watching about your role and how the knowledge of ACEs, adverse childhood experiences, impact the way that you approach your work?
I'll start. So again, hi, and thank you for having me. I am Karen Duke-Smith with Children's Trust of South Carolina, and as stated earlier, I am the senior coach and senior coordinator with the Strengthening Families Program. A majority of my responsibilities include providing coaching support to our funded providers, building awareness around child abuse prevention, supporting programs that we fund, and helping to build strong communities and partnerships around the state. We focus specifically on evidence-based programming, such as Strengthening Families. And then there's also ACEs, Adverse Childhood Experiences, as we call it. And in that realm, ACEs has helped me gain a better understanding of why prevention is important. And I can recall a time when I was doing my initial training in ACEs. I can remember one of the most poignant lessons that I learned during that experience, and it really helped me shape my thinking around asking the question, moving from what's wrong with you and moving more to what happened to you. And so it's that concept alone that has really propelled me into learning more about ACEs, learning what I can do to better empower our communities. What can I do to better empower families who have ACEs and may not even know it? And so this has just been a wonderful opportunity for me to become empowered, and then as in return, empower the community and our providers that we work with.
Absolutely.
And Katie, like you said, all of the children that we serve here at the Children's Attention Home have experienced some sort of trauma. And so understanding adverse childhood experiences and the impact that has on the children's brains and the whole scope of it really helps us better relate to the kids. It helps us better serve them. And like you say, Karen, it helps us understand why they're responding or acting the way that they are, and so that we can support them and respond to them appropriately.
Yeah. Right. I remember the first time I learned about ACEs, it was at I think it was a Together SC conference, or whatever the name was at the time, but I remember going to the Child Protection Training Center in Spartanburg, and it was like a 45-minute presentation, but having a family member who's been in foster care, it blew my mind. I was like, that's it. Like, that's the ticket. Like, that's the key to understanding so much about what I don't seem to understand about maybe how, the different patterns of thinking or the reasoning, or and not that, I have all the answers, but it really was like a light bulb went off the first time I learned about ACEs. And I've just continued to dig into it ever since, just because it's so helpful, I think, in better understanding, as opposed to trying to just, push your way through the knowledge or whatever, as we go through the work in this field. It really does help us contextualize what our kids are walking through and how to better help them move forward in the future. So before we—
I'll also say, if it's okay, that as you spoke about foster care, my mom was a foster parent for over 20 years, and I can remember I just had a moment, an aha moment, when children would cycle in through her home, and I now know, based on what I know about ACEs and based on what I know about child abuse, I now wish that I had ACEs experience or knowledge, or that I could share this information with my mom, because I just can imagine how many young people could benefit even now today, now that we know about ACEs, how beneficial this could be to our young people when we know better, when we're more empowered, and then we can also help our foster parents and parents in general, and then help those same young people become resilient individuals for a lifetime. So that just dawned on me about foster care. So thank you for sharing that.
Yeah, absolutely. So Karen, I'm going to turn it to you now, because we want to learn more about what are adverse childhood experiences. You know, we're introducing it, we're talking about it, but there are a lot of people listening that don't know what that means. You know, so can you talk to us a little bit about what are adverse childhood experiences and how they impact kids?
Absolutely. So I'll just start by saying that ACEs, again, are adverse childhood experiences, and they're potentially traumatic experiences or occurrences that happened in a child's life prior to the age of 18 at no fault of their own. I want to make sure that it's very clear. This is at no fault of the children on their own. And it's an adversity that can harm a child's brain and the brain development, which could lead to long-term negative health and social outcomes, such as homelessness and depression and heart disease. And in some cases, it can even lead to cancer. So it's very important that we learn as much as we possibly can about ACEs and prevention around ACEs, so that we all can be as empowered as we possibly can to assist our young people and our providers that are working directly with families and children. I have a short video that I'd love for us to take a look at, and it may help give a little bit more light into ACEs, and also give our viewers more insight into what Children's Trust does as a result of the ACEs initiative.
I'm going to share that screen here.
Yes, thank you.
Okay.
We all want children to grow up feeling safe and loved, but many kids face hard situations at an early age, which can impact their development. What if we could stop trauma from occurring in the first place? After decades of research, it turns out we actually can. This research focuses on adverse childhood experiences, or ACEs for short. ACEs refer to traumatic experiences in a child's life, both in and outside the home. Researchers have found that ACEs are connected to many poor health outcomes later in life. The good news? We can actually prevent the effects of ACEs. One way we can do that is by strong community supports that ensure all children and families are resilient. Another way is by helping ensure that every child has a caring, nurturing adult in their life. We have the choice to provide safe, supportive environments for children and their families now, or pay later through costly interventions. That's why Children's Trust of South Carolina is leading the ACE initiative to support stronger families and communities across the state. To learn more about the South Carolina ACE initiative, visit sdchildren.org/ACEs.
Great. So that's a synopsis of what Children's Trust is doing around ACEs. And I invite our viewers to log onto our website and learn even more about ACEs and what they can do and how they can help, and even understand better what ACEs are for themselves. At the end of this presentation, we'll share an ACEs survey that everyone can take to get a better understanding of what ACEs looks like in their own lives. But again, we encourage everyone to give us a call, or check out our website, and we can give them even more information.
Good deal. Good deal. Yeah. Like I said, the first time I learned about it was just so eye-opening. There's so much you can learn about it. And so I know we're just doing an overview today, but I highly encourage everybody to go and check out these resources It's fascinating, really, to really feel like you understand a little bit more, not all of it, but a little bit more about, like you said, Karen, what happened to you as opposed to what's wrong with you is just such a mind shift whenever you're working with that have suffered from adverse childhood experiences. So how do you see the current circumstances affecting children who come from backgrounds of trauma? And either of you can answer this question.
Well, I think, the current circumstances, excuse me, it is traumatic. I think just living through what we're living through right now is trauma in and of itself. And so I think we at the Children's Detention Home are being very sensitive to that. The limited and no social interaction is a big deal for our children, for all children, I think, and families. The increased stress levels and just the fear of the unknown, the fear of the virus, the fear of the fallout, the lack of the community support. All of these have different implications for us as an organization and for the children that we're serving. And so we've been really careful with our kids that we're not re-traumatizing these kids who have already been through trauma, who are already dealing with some of them multiple adverse childhood experiences. And so we are trying to be very mindful of the effects that can have on them. And the thing is, we don't know what the effects can be, or how this is going to continue to impact them. And so we're really trying to take it day by day and listen to the kids and normalize what is a very unusual situation.
And I'd just like to add that, as I was thinking about ACEs and this weekend, I just thought for a moment, imagine what our lives look like. Imagine the upendedness that we've sustained ourselves. But then I imagined, what does this look like for a family who already has a significant amount of stressors on them? And then I also thought about their trauma, previous trauma, and then their vulnerability in this space right now. What does that really look like for those families? I mean, as some of the things that Emily mentioned, but if we just think about the fact that some families have loss of income or loss of employment. There are food and shelter insecurities going on. You have homeschooling parents trying to do the work of teachers, which I appreciate so much. There are just so many stressors in a home today. And then imagine, on top of all of that, a child could potentially be harmed by some form of child abuse. Those things alone make me want to do more, to learn more, and to empower others. And it's just, there's just so much that we have to do, that we have to understand, and we have to learn about ACEs and its harmful effects. But then we have to think about this crisis and then what it looks like after the dust settles, because that's when we really find out more about what these traumatic experiences look like in the households. So I encourage all of our viewers just to be thoughtful about your neighbors, your family members who are going through hard times and hardships, as we all are, but reach out to them and lend some support in whatever way that you possibly can. I ask that everyone lend some support, including the social distancing, but there's so many things that they can do right now. And we'll get into those things a little bit later, but that was one of the thoughts that I had this weekend. Just imagine what families are going through at this time and what young people are going through.
Karen, I'm so glad you said that. That really is one of our biggest concerns at this moment through this crisis. The number of reported child abuse cases has gone down so significantly, and it's because nobody is seeing the kids. The kids are not in school. The kids are not going to dental appointments or to see the doctors or interacting with their coaches and friends and friends' families and things like that. And so I think where we can remind folks that more than ever, we've got to keep our eyes on our neighbors and on, the kids that could be in these situations. we've got to take that opportunity because it's so scary. And just like you said, when circumstances get bad, when stress is high, these kids are even more at risk. And so I'm glad you mentioned it because it really is a big concern right now.
Yes.
And we did a Mission Monday video last month talking about how, you in the community, you don't have to be a mandated reporter to help report what's going on and help voice for these kids as it relates to child abuse and neglect. And so you don't have to be trained to make a report. And so you can check that out in our videos. So kind of transitioning a little bit to what you were alluding to, Karen. So for the kids and the families in both of your programs right now, how are they responding and what are you hearing from providers and what are you doing right now to support them through the current situation?
Okay, great question. So majority of our programs and services were suspended mid-March, I would say. But during that suspension period, we encouraged all of our funded providers to continue to engage with the families that were in our programs. So Children's Trust was fortunate enough to allow our providers to continue to engage our families, both virtually and through telephone calls, Facebook, social media in general, through FaceTime, but we encourage them to continue to reach out to families on a weekly basis and provide as much support as they possibly could. So that could have come in the form of, one of the things that we did encourage them to do is to continue with the Strengthening Families curriculum. And they were able to continue to engage families on activities and in lessons and refresher courses. And we just really, really felt the need to keep our families engaged through this process, not only to keep them engaged in the Strengthening Families program, but also to keep building resources and to keep allowing them to know that they have concrete supports in their community. Also allowing them to know that someone cares and someone's always checking on us. And through this process, our families remained engaged. And I'm happy to say that at the beginning of May, we've been able to reconvene our programming virtually, that is. So we use virtual platforms to continue to engage families. And now we're moving forward with programming, with the actual programs. And so through these initiatives, our providers are able to provide some of the resources that families need from some of their needs through our funding. And we're really excited about that. I jumped on one of the virtual sessions last Thursday, and it was the first night that all the families had gotten back together. And I have to let you know, I was amazed to see the children in their respective homes, in their respective spaces, excited to be a part of the program again, excited to see their new family, their new concrete family, concrete supports and families that they've created in the community. It was exciting for them. I was also very amazed that because they've already started working with their group leaders and they already kind of got an idea of who their classmates are, they were eager to be a part of it. They were eager to jump back into the lesson. And the parents looked like they were as enthused in their separate sessions. So we're very encouraged by what we saw. I'm very, very encouraged by what we saw. And I believe this week, most of the 23 providers who've agreed to move forward in the virtual platform will be initiating their programs this week. So we're really excited about that. And speaking on behalf of Children's Trust, I am really, really excited that we were able to maintain the majority of our families and have them come back and regain their connection with with the Strengthening Families program in a virtual platform. So yes, we're very excited about that.
That's fantastic news, Karen. That's great, especially considering what we just talked about with making sure that, we're insulating, and surrounding these families with supports during this time where they need it the most. So, Emily, what about the home?
We're really excited about that.
Yeah. Emily, what about the home?
I'm sorry. I wanted you to get your whole thought out there before I jumped right in. the network piece is so important. And so we really are trying to support our teammates who are taking care of the kids. We're trying to continue staff training. We also have an online training program. So we're trying to use this opportunity to continue to educate them on things that they may be seeing, so that way we are listening to the kids. If there's something that's happening through all of this that could be a trigger to the kids or could be, you know, particularly upsetting, we want to be aware of that. We want to respond appropriately. And so we're really just trying to support everybody as much as we can. We're trying to factor in one-on-one time with our kids. We're trying to get them outside, just staying active. Again, trying to normalize things as much as they can. So while we can't go out and do, you know, activities like we normally might, we can go on walks, we can go around the neighborhood, you know, we can engage in conversations with them. And so we're doing a lot of that. Karen, through in the video, it talked about the you know, having that caring, nurturing adult, and that's so important. That's really the heart of what we do here anyway. That's very important to us, is to build that support system for our kids. And so I think now more than ever, we are really trying to make sure that our folks here are equipped to take care of our kids and to be that support system for them, because we don't know, you know, again, this is an unusual circumstance. Nobody's been through anything like this before. And so we're not sure how it's affecting our kids. And we want to make sure that we are taking the time to listen to them and to be aware of cues and signs that things might be a little bit harder than before. We are still, our kids are doing mental health visits and things like that. All of that, of course, has shifted virtual, just like you were saying as well, Karen, but we are maintaining that. Again, it's as important now as it ever has been before. So we want to make sure that even though it looks a little bit different, the kids still feel that sense of a support system. Caseworkers and guardian ad litems and folks like that make up the children's support system, they're still doing visits. Again, they're all virtual, but we're making sure that we are having those as regularly as we can. So again, the children have an outlet, they have somebody to talk to, and we can hopefully kind of get through this phase and transition without them feeling like they've lost more folks, more connections than they had before.
Right.
Yeah. So how can those that are watching, how can they apply the knowledge of ACEs to help kids that they know or are close to, or families? What resources are available right now that y'all are aware of to help people apply this in their spheres of influence?
Well, we know that the way to conquer ACEs is through resilience. And resilience is built through providing continuous protective factors around children, supporting them, having nurturing, caring, loving adults around them, having agencies and partners who provide resources and services. So that's our way forward, is to prevent, in terms of preventing ACEs and other child abuse. It's to become as resilient as we possibly can. And recently, our CEO, Sue Williams, wrote an article, and it was basically talking about how to help families during the social distancing, during this social distancing experience. And so I would like to share that if we have time, just to share that with our viewers so that they can take a look at it and get an idea of what some of the tips that she shared. The first one, and these are some things that we can do during this COVID experience, but it certainly applies to all times. So we encourage loving, caring adults to not only try to use these tips now, but we encourage you to use them, you know, as time goes on. So some of the things that you can do is to, first, can you go down up a little bit? The very first one is, yes. The very first is to, oh, I'm sorry, you can go back down, I apologize. I was a little ahead. Is to be patient with ourselves and give ourselves and others grace. And we know that in this crisis atmosphere, we are all stressing and struggling to get just from day one to the next day. And so we just ask that you give yourself grace and be patient with yourselves. And then the next is help others meet their basic needs. Some of the things that I've done here in my own space, trying to be as safe as possible, is I've called my neighbors luckily we have what is it called? Nextdoor,
Oh,
the Nextdoor app. And I've been able to connect with some families who've had some basic needs, just very basic needs, that have children, small children, and they may not be able to run out to the store as often, or they may need food services. So I sort of put myself out there on Nextdoor app and stated specifically what I can do. And that included buying grocery. I can't come in their homes, but I was able to go purchase some groceries, put them on their doorsteps. I was able to buy masks and deliver them throughout the neighborhood. So everybody has something that they could do to just help provide those basic needs that families may be in need of. And so I was happy to be able to do that. Another is help Children's Trust partners across the state. And that could be through generous funding, that could be through resource building and resource sharing. There are just so many things that we can do, like purchasing supplies, purchasing Pampers, wipes and disinfectant products, which we all know are hard to come by at this time. But if you see it, another thing we've been able to do is, what I've been able to do is, if I see products, and particularly those disinfectant products, I would just put it out there on social media. Hey, this is where you can find this, or in the Nextdoor app, just trying to provide as much support across the state as we possibly can.
Mm-hmm.
Connecting with others to organize that are actively helping families, so much that we've already talked about before. Be a friend to families. Some of the same that I just discussed. Build your personal resilience. And I really, really want to look at this one more in-depthly. It basically says managing stress is a learned skill for parents and for their children. Tap into your faith if that is in place. Reach out to someone who if you feel someone that's getting overwhelmed, use your employer assistance program if it's available, which is very, very helpful. Take a few minutes away from everyone to collect your own thoughts, to be with yourself and decompress. And even if it's in the next room or going for a walk, just take care of yourself. That is very important, because we all know that if you don't take care of yourself, you pretty much can't take care of others. So we encourage you to do that.
Mm-hmm.
And then help kids understand their own feelings. Help kids process what they're feeling right now. And beyond, are you okay? Because sometimes when we ask, are you okay, that implies that something's wrong. And so we just ask for adults, caring, loving adults, to be there for kids in that way. And because it's very important that we remember that they too are going through these experiences of trauma during this COVID experience. And so we just really want to empower people all over the state and all over the country, for that matter, to be there for each other, to support one another. And I also encourage you just to learn more about ACEs and find out what it is and how you can help a child that may be going through traumatic experiences in their own lives.
Yep. What a great set of action steps that we can take.
Mm-hmm.
I love that you mentioned the Nextdoor. I hadn't thought about that, but yeah, just as something as simple as putting it out there, maybe instead of on, I'm not necessarily friends with all my neighbors on Facebook, but you put it in the Nextdoor app, and that's close to people, and there's a lot of people that use it. So that's a great way. That hadn't crossed my mind. So thanks for sharing that. Yeah.
Good.
And will be posting all of the resources that we showed today, as well as some additional ones that Karen has shared with us.
Yes.
At the bottom of this video in the description. And so feel free to look through those, look at the Children's Trust website. That's a great place to get started and to look into a whole lot of resources about ACEs. Do you have anything you want to add here at the end? Closing thoughts?
Thank you. That was so helpful. I really, and it really is validating, I think, to, to see it there. And I think a lot of people are, struggling in a lot of different ways, even just adapting to new and different roles and, taking on new responsibilities and just, the fear and the worry that they have. And so I think, seeing it there and hearing it from you that we can take care of ourselves and we can take care of each other. I think that makes such a huge impact. And so I think that's something great to take away. I'm glad that we've got that information.
Mm-hmm. Agreed.
And I also encourage anyone who wants to learn more about ACEs, we have experts in the field that would be happy to come into your communities to share as much as we can and provide training and support around the ACEs and strengthening families as well. Thank you all for having me.
Absolutely. Thank you both for joining us today. Like I said, if you want to learn more, check out the description in the video or below the video. And if you have any questions, reach out to me. Otherwise, I hope you have a great rest of your day. Thanks.
Thank you. And thank you for inviting me. Really,
Absolutely.
thank you, Emily.